24 hours a day, 7 days a week, there is a clinician, typically one of the critical care practitioners on duty at the EMERTS Critical Care Hub based in the Ambulance Control Centre in Cwmbran. A typical 999 call that may or may not result in us going would look like is that I would spot a call with a brief description in the notes on the ambulance call stack, and I will then open the call, review the notes that have been entered by the ambulance service call taker.
Ambulance service, what's the full address of the emergency? Okay, just bear with me while I search for that for you. Patient breathing. Okay, tell me exactly what's happened.
Yeah, thank you, 4012. This is an Amber 1 detail, please, in Herwain. This is a head-on collision, unknown number of patients at this time. You do have EA backup, 2 EAs, one ETA 10 minutes and the second one ETA 12 minutes. Dom has been informed and can see that EMERTS are reviewing this detail over.
Essentially what I'm looking for is life or limb threatening injury or illness. There's an RTC that's caught my eye by you, Linda, in Aberdare.
Right, I got it, yeah.
Are you alright just to monitor the stack otherwise?
Certainly will.
Right, I'm just going to ring back scene and just interrogate the call just to see if it's one that we need to go to. Hiya, my name's Corey. I'm a critical care practitioner with the Wales Air Ambulance. Can I just ask you some questions about the 999 call you've made, please? Just to let you know, the line's recorded. These questions are not delaying help in any way. I just need to make sure that we're sending the right resources to the patient. Are you there with the patients now? Okay, all right. What I'm going to do is I'm going to send a link through to your phone with a text message. I just need you to allow and accept all the permissions, and then I'll be able to see the scene through your camera on your phone. Is that all right? Are you all right to ask the injured people if they're happy with that? The images are not saved. Okay. I'm just gonna... Okay, there's an invite coming through to you now. So it's something called Good Sam. I just need you to allow all the permissions and then I'll be able to see what you can see. If I decide that I'm going to send a critical care team, I will then speak to my dispatcher colleague and get them to activate the critical care team that I want to send to the incident, which may not necessarily be the nearest. Right, Linda, this is going to be a definite send. Can you send Helimed 57 from Davern and back them up with Welshpool? I think there's going to be 2 patients that are going to need critical care. The one in the car is probably going to need an RSI and or blood, and the one patient that's come out of the car, I'm quite concerned that they appear to be bleeding, so they might need blood as well. Carnarvon are already out doing a transfer as well, so we'll send Davern and Welshpool, please.
Certainly will do. I give him a bell now.
Thank you.
Hiya Dewi, it's Linda on the desk. We've got a job for you, please, in the general area of Aberdare. Your grid reference, Sierra November 975056, head on RTC. We're also going to be sending Helimed 59 from Welshpool to back you up. Multiple patients. Corey will call you direct to give you a clinical update. Roger, thank you. Hiya Kate, it's Linda on the desk. We've got a call for you, please, in the general area of Aberdare. Grid reference Sierra November 975056. We've got Helimed 57 en route as well, multiple patients, and we'll give you a clinical update once you're in the air. Roger, thank you. Bye. Yeah, they're on their way, Corey.
So once the decision's been made, the team have been activated, they will let us know whether they're going to respond by air or by road, which is dependent on several factors: weather, distance from base, and other issues. So once we know how the team are going to respond, we'll make sure that they are allocated on the incident, and then that starts a sequence of various actions. For certain incidents, we need to be in contact with the police to make sure that roads are closed for us to land, or for them to clear crowds away for us to be able to land at certain sites. We may also need the fire service for certain security at landing sites or for certain types of incidents. So for a road traffic collision involving fuel we would also want the fire service to be attending also if the patient is trapped in the vehicle. So as thinking as the clinician, I'm trying to put myself in the shoes of the CCP that's on the aircraft responding to the incident and thinking about what they would want, what they would need at whatever instant it is that they're attending. So we also need to speak to hospital helipads and make sure they are ready at our arrival, and then we're also in constant communication with our responding crews, typically by radio and also by phone, to keep them appraised of whatever's going on at the scene. Linda, I've got Bronglice emergency department on the phone about a thrombectomy transfer to Southmead. Am I right to just transfer the call through to you? And you can have a conference call with Top Cover. There's a couple of calls just popping up on the screen that I need to look at.
Hello John, it's Linda on the desk. I've got Bronglice on the phone. Would like to discuss a transfer to Southmead for a thrombectomy patient. Yeah, thank you.
Right, so we've got a paediatric arrest in Barry, an 18-month-old with CPR in progress. I'm going to dispatch Cardiff. IS67, can I dispatch you to Barry, please, for an 18-month-old cardiac arrest, CPR in progress? Yeah, you're going to go by car? Okay. All right, put you on in now. Thank you.
Hello police, I wonder if you can activate Mountain Rescue to Snowdon. We've got a patient there who's got an open fracture. Their foot. Helimed is en route, but they may need some help on the summit. Yep, thank you. Ring Top Cover again now for the paediatric arrest. Hello John, it's Linda again. I've got the crew of the paediatric arrest. I wonder if you could have a quick word with them. Thank you. Right. Yeah, they're going to do the transfer now, Corey, so I'm just going to ring WAST and see if we can get a truck at the landing site in Bronglice. Hiya Central and West, I wonder if we can arrange a truck please to meet Helimed 67 at the playing fields for Bronglice. Yeah, they've got an ETA of about 35 minutes. Yep, thank you. Cheers, bye-bye. Better ring those, the danger areas. 1 second. Hiya Delta 117, can you tell me whether you're hot or cold, please? You're hot. We're coming through, we'll probably be going through your area in about 10 minutes. Are you able to go cold for us? Yeah, thank you. We'll give you a bell back as soon as we've gone through your danger area. Thank you.
We are the gatekeeper to communication between the crews at scene, the hospitals, and our Top Cover consultant where required.